Meet KHIAN, a diligent project manager renowned for his impeccable organizational skills. He thrives in his fast-paced corporate environment where deadlines loom and expectations run high. However, beneath his composed exterior lies a constant battle with panic disorder. KHIAN usually finds himself juggling multiple high-stakes projects, each demanding his undivided attention. Emails flood his inbox, he receives messages upon messages, and urgent phone calls interrupt his concentration. His boss is his greatest source of stress as he has high expectations to his workers and their performance. As the pressure mounts, KHIAN's chest tightens and his breath becomes shallow. A familiar wave of dread washes over him, signaling the onset of a panic attack. Despite his best efforts to quell the rising panic, his heart races uncontrollably, and he struggles to catch his breath. He knows that he has disappointed his higher-ups. Feeling overwhelmed, KHIAN retreats to the privacy of the toilet, desperately trying to regain control of his racing thoughts. The weight of his responsibilities feels suffocating, amplifying the intensity of his panic. He tries washing his face to clear his mind, but it's not enough. He feels nauseous, like he's trapped in a never-ending cycle of work and stress. KHIAN feels helpless to break free from the cycle and is hesitant to reach out for emergency services. Knowing that he cannot deal with this on his own, he finally decides to seek help from a psychiatrist.
Good morning, Mr. KHIAN. So what brings you here today?
This day I feel anxious easily and I don't know what happens to me.
Oh, I see. Can you tell me more about your symptoms?
Sometimes I feel like I'm hard to breathe and I feel my chest is very pain. I don't know, it's like a heart attack, but it's not because I don't have a heart failure or anything. And then thirdly, I also feel tremble and shock easily, especially when just doing a normal activity. And lastly, I also feel like I'm not my own body. Okay.
I see. So, how often do you have this kind of attacks?
It happens once a week, but sometimes it also happens more than that.
I see. Do you know what kind of things that triggers this kind of attacks?
It happens just out of nowhere, and I don't know what triggers me.
I see. So, based on my observation, I think you have panic disorder.
Panic disorder is a condition where the patient experiences frequent and unexpected panic attacks. Panic attacks are defined by the DSM-V as abrupt surges of intense fear or discomfort that can reach their peak within minutes. Panic disorder tends to develop during the late teenage years or early adulthood and can disrupt one's ability to function normally. Just like we saw earlier, KHIAN was struck with a wave of intense dread and nausea. What he experienced are all the telltale symptoms of a panic attack. Other than that, panic attacks can manifest as sweating, chest tightness, depersonalization, and trembling. This is why panic disorder can be disabling for those who suffer from it. There are three main categories of triggers of panic disorder, which are psychological, pharmacological, and environmental causes. Stress and post-traumatic stress disorder (PTSD), both categorized under psychological causes, are the most common triggers of a panic attack. The individual experiences heightened emotions, leading to intense heart palpitations and nausea. Individuals who partake in heavy alcohol and drug use can also experience panic attacks. This is because large amount of alcohol can deplete GABA, a neurotransmitter that induces a relaxation effect. Drugs such as cocaine can increase the heart rate and blood pressure. Environmental triggers such as significant life events can also lead to heavy negative emotions, triggering panic attacks. For instance, grief, high-pressure working environment, and social pressure. Panic disorder can also be genetic. Studies have found that individuals have a 40% chance of experiencing panic disorder if they have a first-degree relative with the same disorder. Women are more likely to develop panic disorder compared to men. This may be because women are more sensitive to low levels of corticotropin-releasing factor, a hormone that organizes stress responses in mammals, making them more vulnerable to stress-related disorders. Nevertheless, it is also important to note that unlike anxiety attacks, panic attacks can occur suddenly and unexpectedly and may not have a specific trigger. It usually lasts for a shorter duration, ranging from minutes to hours.
Panic disorders can be treated by pharmacological and non-pharmacological treatment. The drug used in pharmacological treatment can help to reduce the intensity and frequency of panic attacks and improve the quality of daily life. There are a lot of different medications approved by the FDA and prescribed with different dosage to the patients. One of them is benzodiazepine. Benzodiazepines such as alprazolam and lorazepam are central nervous system depressants, which are used only on short-term basis due to habit-forming and mental dependence adverse reactions. This type of medication cannot be used for patients with alcohol or drug abuse. The second class of drug is selective serotonin receptor inhibitors or SSRI. SSRI such as fluoxetine and paroxetine are generally safe with a low risk of serious adverse effects. This class is usually recommended as the first choice of medications for panic disorders. However, it is important to note that fluoxetine must be given a drug holiday of 5 weeks between other drugs as it has a long half-life. The third class of drugs that can be used for the treatment of panic disorder is tricyclic antidepressant. This class of medication is sometimes prescribed to patients to keep more serotonin and norepinephrine available to their brains. Medications such as clomipramine and desipramine are often used, but they are more likely to cause constipation and dry mouth. Switching to other tricyclic antidepressants may help to reduce the adverse reactions. On the other hand, there are lots of different non-pharmacological treatment for panic disorders. Cognitive behavioral therapy or CBT is one of the most widely used and effective treatment for panic disorder. It combines cognitive therapy, which is examining the things you think, and also behavioral therapy, examining the things you do. It is a type of talk therapy that helps people understand and change their thought patterns and behaviors. The theory behind CBT is that the way we think about situations can affect the way we feel and behave. It does this by dealing with how your thoughts affect your feelings and behaviors and teaches you coping skills for dealing with different problems. During CBT sessions, a therapist works with you to identify negative thoughts and behaviors that trigger panic attacks. Then, they help you develop healthier ways to respond to these thoughts and situations. This process helps to reduce frequency and intensity of panic attacks over time. CBT may include countering anxious belief, exposure to fear cues, changing anxiety maintaining behaviors, and also preventing relapse. Typically, CBT involves weekly sessions, but the exact frequency can vary based on individual needs. Some people might need more frequent sessions initially, while others may find progress with less frequent visits as they improve. Besides that, practicing stress management and relaxation techniques such as deep breathing, progressive muscle relaxation, and mindfulness meditation can help reduce the physiological arousal associated with panic attacks and also promote a sense of calm. Furthermore, you are encouraged to join a support group. Joining a support group for people with panic attacks or anxiety disorders can connect you with others facing the same problems. Last but not least, some people find relief from panic disorder symptoms through alternative therapies such as acupuncture, massage therapy, or herbal supplements. While the evidence for their effectiveness is limited, they may still be worth exploring as part of comprehensive treatment plan.
There are a few ways to prevent ourselves from getting panic disorder. First, having an open and honest conversation about your feelings with someone you trust can provide support and understanding. For example, you may talk to your parents, siblings, counselor, and friends. Secondly, practicing mindfulness and meditation can help in removing negative thoughts and emotions. Consider taking a vacation to relax and release stress, promoting overall well-being. Thirdly, you should identify triggers and avoid them. Keep track of situations that trigger anxiety and develop strategies to cope with them or avoid those triggers. It is important to steer clear of caffeine, alcohol, and smoking as they can exacerbate panic attacks. It is important to surround yourself with positivity. Stay away from pessimistic individuals and instead surround yourself with motivated and energetic people who can uplift and support you. Prioritize a healthy lifestyle by ensuring you get enough sleep to rest your body and mind, maintaining a balanced diet, and incorporating regular exercise into your routine to promote overall well-being. When experiencing a panic attack, it is important to remember not to try and stop all the symptoms immediately. Trying to fight the panic attack will only lead to more anxiety, fear, and frustration. Once adrenaline is released into your body, it takes time for it to metabolize, so you can't stop the panic attack right away. Instead, develop an accepting attitude towards your symptoms. Remind yourself that panic attacks are not dangerous and will not cause any harm, such as heart attacks, mental illness, respiratory failure, stroke, or death. Give the fears time to pass and use positive self-statements like, "This is only anxiety, I am not going crazy." To prevent hyperventilation, learn and practice diaphragmatic breathing. Breathing is under our conscious control, so it is the best way to induce an opposite response to the fight or flight reaction. Slowly breathe in through your nose to the count of 4 or 5, and exhale through your mouth again to the count of 4 or 5. If you are breathing properly, your stomach will rise at the end of each inhale. Put your hand on your stomach to assess whether you are breathing properly. Besides that, you can use distraction techniques to alter your focus of attention away from the bodily symptoms you're experiencing. Examples include chewing gum, focusing on academic or work tasks, working on your computer, playing with a ring on your finger, or counting backwards in trees from 100. Identify your early symptoms of panic such as sweaty hands, an increase in heart rate, tightening of muscles, or dizziness. Developing an awareness of these more subtle early symptoms and applying coping strategies at this stage makes it much more likely that you will be able to prevent a full-blown panic attack. If you have no medical contraindications, you can also use symptom induction techniques. Use these techniques for approximately 30 seconds after you notice anxiety or any unpleasant symptoms, and repeat them once per day until they no longer make you anxious. The techniques include hyperventilating for 2 minutes, holding your nose while breathing through a straw for 1 minute, stair climbing for 90 seconds, spinning around in a desk chair for 1 minute, or tensing up one of your muscle groups for 1 minute. After completing the techniques, practice some of your previous coping strategies to reduce your anxiety. Lastly, trying medication is a last resort if the above strategies do not relieve your symptoms. The classes of drugs include antidepressants such as SSRI, SNRI, TCA, and anti-anxiety such as benzodiazepine. SSRI antidepressants are typically recommended as a first choice of medications to treat panic attacks. Examples of SSRI antidepressants are fluoxetine, paroxetine, and sertraline. TCA such as imipramine, nortriptyline, and clomipramine may be considered for the management of panic disorder if the SSRI is not suitable. Besides that, there is also an anti-anxiety medication such as benzodiazepine. Benzodiazepines are generally used only on a short-term basis because they can be habit-forming, causing mental or physical dependence. In conclusion, panic disorder is a mental health condition that significantly impacts the life of those who suffer from it. As we have explored today, its symptoms can be debilitating and the causes can be multifaceted. Despite its challenges, there is hope. Effective treatments can help individuals manage and overcome their symptoms. Early diagnosis and intervention are crucial in improving outcomes and quality of life for those affected. As we move forward, it is essential to continue raising awareness, reducing stigma, and supporting research into the causes and treatments of panic disorder. By doing so, we can foster a more empathetic and supportive environment for those afflicted. Thank you for your attention and commitment to understanding panic disorder.